Now that sets the conversation tonight. We're looking at the healthcare crisis, and joining me in studio is none other than the chairman, national chairman, Kenya National Union of Medical Laboratory Officers and Medical Lab Technologists, Mr. Odipo Nicholas. Thank you very much for your time.
Thank you.
Now, at a time when, even the church is saying we're ready to mediate in this crisis, under your umbrella, I'm saying the lab officers are now joining the foray when it comes to industrial action that is being taken by medics across the country.
Yes.
You're definitely not being part of the solution. Why? Why now?
Not that we are not being part of the solution.
Yes.
I think if you see a frog jumping in broad daylight, it means something is behind its back, its life. All these issues, they are accumulation of issues that we've been talking about with the government. Unfortunately, the government is turning her back on the healthcare workers. So we are left with no option but to go on the streets and fight for the rights of healthcare workers, and also to fight for the quality of healthcare services in the Republic of Kenya. So we are not exacerbating the crisis. It is the government that is exacerbating the crisis. It is, the ball is on their end. They're the ones who are supposed to play the ball.
Now, on a spot check on various public health facilities, since the medic strike actually began, services have actually ground to a halt. Now you're issuing a strike notice effective midnight tonight when it comes to lab officers. What does that mean? So it means you're not going to get tested, or what does that mean? I mean, no lab works going forward.
Our strike is starting on Tuesday.
Oh, Tuesday.
The one that is starting tonight is for the clinicians.
Okay.
What this means is that all lab work is going to be paralyzed. All the testing, all the blood banks, all the research, they're going to be paralyzed. Yeah. So it is not only the simple lab tests that are being done in the hospital. It includes so much, because our members are drawn from the institutions, the research institutions, the hospitals, and the training institutions. Yes.
Now, Mr. Odipo, we know that doctors have a Hippocratic oath.
Yeah.
Preservation of life.
Yes.
Now we'd want to know guidelines, in your service, or rather delivery of service within the medical field. Do you have a guideline to that?
We have a guideline, but it reaches a point whereby you cannot continue working the way things are.
So share that guideline so that then we can pick it up from there.
Okay, fine. We have guidelines that guide us in the services that we give. Yeah? And everyone else observes that guideline. Yeah? But we are health workers. We are employees. And employees, there are rights of an employee. It doesn't mean that if you have a guideline, then you sell out your rights that you are supposed to follow, yeah, and follow that guideline. As an employee, there are rights that are needed for an employee. If these rights are violated, then what does that mean? The morale of working goes down, yeah, in the workplace. It becomes difficult for you to provide the services, because healthcare services are not just like any other services. These are critical and essential services that needs people who are in their right state of mind. Yeah? But now there's a situation whereby you are pressed to the wall. You are not in your right state of mind. What do? You have to protest
now,
and
as
get
you're
for your rights.
Let us look at some of the calls that have been made by various stakeholders, including government officials as well as private sector.
Yeah.
There have been calls to have medics, everyone within the medical sector, in the event of loss or life-changing, complications during this time that, you know, you're under industrial action, that they bear the brunt of it, that it can be actually criminalized because it's denial of service. What's your take from those people who are saying such?
You see, Regina, the provision of healthcare services is in the Constitution. It is a right. Who is supposed to provide that right? It is the government. How does the government provide the services? Through employing healthcare workers and providing the necessities that are required in provision of healthcare services. So, if there's someone who is supposed to take the responsibility in case there's loss of life, there's suffering of patients out there, it is the government. Because they're the ones that have been given the power by the Constitution to provide healthcare services to the citizens.
So then the employees are not ready to carry the brunt of the ripple effect. You say it's government that should...
We work. Mm-hmm. We work. And then the government is supposed to be responsible for our well-being at the workplace. So if they neglect the well-being of the employees, what do you do? Even a vehicle, a car, if you have a car, you must take that car to service. If you don't service that car, it will not provide you with the services that you need. Yeah? So the people responsible for any loss of life, it is the government. Mm-hmm. Not healthcare workers. Healthcare workers are innocent in this situation.
Okay. They're innocent. We say we are innocent until proven otherwise. Now, there have also been calls to have a change in leadership when it comes to matters of who is heading the health docket. There have been calls left, right, and center. Do you think that that would be the right direction to take, or what recommendations would you have therein when it comes to how we are handling this health crisis?
Now, when you are given a job, there's performance contract that you sign, which means that the work that you'll be given, you have to do it to the best of your knowledge. As currently, the CS Health hasn't done that work properly.
In your opinion?
In everyone's opinion, including the citizens of this country.
Well,
yes,
we are asking you as an individual.
Because all these issues, we've been discussing them. We've had various forums. In October, we had a meeting with the Minister of Health. That meeting took 2 days here in Kiambu, and then it culminated in signing of the Kericho Declaration. That was a goodwill from the unions. Yeah? They gave us timelines in executing this declaration. And we said, now, we'll give you the timeline that you've requested. Please go and act on these issues. October, November, December, tomorrow will be April. None of the issues have been
looked into. And when I look at some of the issues that have been raised, it's the issue of employment of those who are working, interns, you know, and their registration, subsequent registration therein. But then it means also it is a capital intensive. It is capital intensive. I am being the devil's advocate here. It is capital intensive. And also government has said, as you said, you had a conversation, they said, fine, we are going to do this. They have not honored. And looking at what the CS said is that she's just appealing for time and also, you know, for the health workers to be a bit alive to the current situation that we're having, or rather government is finding itself in terms of funding and such. In your opinion, Mr. Odipo, what main key points, if they were addressed, you said industrial action is going to take place on Tuesday. If addressed, you're going to be at work.
Now,
3.
Now,
yes.
In our strike notice, we had various demands that we made to the government. One of the demands was absorption of UHC workers. Another demand was absorption of Global Fund employees. These are colleagues who have been in contract since 2009. You cannot tell me that somebody is working on a contract since 2009 without a government making arrangements in absorbing these people into permanent and pensionable terms. So if you're telling me that right now there's no money to absorb them and these people have been working for over 15 years, what do you mean? What do you mean? This country, every year there's a budget that is read and is funded by the citizens of this country. I pay taxes, you pay taxes, everybody else pay taxes. Where are these taxes going? Somebody working for 15 years in contract. If you look at the Employment Act, the highest number of years you are supposed to work is 6 years, and then you should be absorbed into PNP. These colleagues are losing a lot. Yeah? So you cannot tell me that in 15 years you've not made arrangement to absorb 114 employees.
Now,
that is a lie.
You've said from 2009 we're looking at 15 years.
Yes.
It seems that the leadership, the CS currently, has inherited historical injustices, so to speak, using that term. And now she's finding herself on the hot seat trying to, figure out how to get out of this crisis. So if you were in her position, what would you address and how would you go about it? Because government has already pronounced itself that it is having a shortage of funds. And what I'm hearing or what we have seen is, consumers of what the striking medics have said is the issue of absorption, employment and such is actually the main pain point right now.
Yeah.
What would you do? Where would you find the funds?
Now, government is a continuous existence.
Yes.
People come into government and people leave government. Yeah? So, if any case, right now I'm sitting here as the national chairman of Kenya National Union of Medical Laboratory Officers. I will go. Someone else will come and will get, if there are things that have not been done. Is that person going to sit and saying, no, these ones were the previous person's issues, let me brush them away? You cannot. You cannot. This government has been in power for close to 2 years now. If they got this mess, from day one, they were supposed to have started working on ways of solving this mess. But here we are, people pretending to be working and not working.
So are you ready as lab officers to sit at the negotiation table?
We are very much ready. If you look at our strike notice, the last line, we told them the union is ready for negotiations that will be aimed at resolving all the grievances that we've raised. They have not called us. We gave them 7 days. They have not. So what do? It means they don't want to sit down with us. We shall proceed on strike because that is the language that they hear.
Well, so from where, just a parting shot is that, do you see an end in sight for the current crisis that you find ourselves in the health sector?
If the government wants to end this crisis today, they will end it. They will end it once and for all.
Okay.
But there's no willingness in them to end this crisis. So it shall continue so long as they're able to come to call us to the negotiating table, give us what we want, and everybody goes back to work. And we are happy serving this country.
Unfortunately, those who are suffering are those who have patients in hospital, those who are unwell. That is Wanjiko, that is a taxpayer that requires these services, I'm imagining. Anyway, we'll be keeping tabs of that, on that. Thank you very much, Odipo. Nicholas is the national chairman of the Kenya National Union of Medical Laboratory Officers there, who have issued a strike notice come Tuesday if government does not have them at the negotiation table going forward, exacerbating the health care crisis that we find ourselves in. That puts a cap into our conversation tonight. We take a quick breather. We'll be speaking sports soon. Do keep it right here. Africa.